Hi, this is Dr. Nami again, and I wanted to share some befores and afters with you, and some really great fun cases. Actually, the one I'm going to share with you today is a physician that focuses on the ear, nose, and throat. And it was really fun to share this case because, I feel like the medical industry really looks at dentists as like, I don't know, whole pluggers or whatever you want to call it. And they don't really understand the value that we provide for them or to value the care we provide for our patients. Because, I'm really looking at how can I optimize you? How can I help you prevent from getting to the hospital, right? Like once you get to the hospital, they're just looking at how can you stay alive, right? My thing is like, I want you to ever avoid seeing them. I want you to have a great quality of life. And if there's something that needs to be taken care of, let's do it early so that it's time effective, cost effective, and health effective and the best for you. So this is a fun case to share. So here we go. This is one of my ENT physicians, and always has sinus congestions, always has acid reflux, and just doesn't understand, like heavy grinder, does not really understand what's going on. So the first thing I did is I checked the genetic risk for inflammation. It came out to be high. So that means that this person is more more likely to get a heart attack, diabetes, and cancer. And when I see those things and I see this oral microbiome, we have a lot of bugs here. We've got the green light bugs, yellow light bugs, and the red light bugs. Now, even though they're below the threshold, especially these three, I am on this patient like a hawk. And the reason for that is, oh, actually, let me share my screen so that way you could see it. Here we go. So, again, knowing that the genetic risk is high, I am looking at this, and I tested the genetic risk through a different test already, so it's already in there. So when I look at this, I see that this patient has a lot of red light bacteria. So anytime I find somebody that has high risk, I am a helicopter mom. I want these guys out because their immune system is going to be more active than somebody else. So remember during COVID, there were people who got really sick and there were people who didn't have any symptoms. Now, the people who got really sick were because they actually had a genetic risk for it, and we don't want that. So when I look at somebody with these red light bacteria, excuse me, when I see that anybody with a high genetic risk and a bacterial link like this, what we do is we are going to recommend a deep cleaning. Especially because PG, as I've said before, is causative for Alzheimer's. I definitely don't want that in somebody's mouth. This person also had acid reflux, misdiagnosed, sleep apnea. And again, this is a physician, ear, nose, and throat physician who deals with this every single day. So it was really fun to work with him and really help him realize the value of their oral health. And especially because the mouth is so connected to your nose and throat, right? And so you can see his results right over here. Wonderful, 88% reduction, got rid of all these bacteria. We have a little bit of FN, which we do want, and then all of these are gone, and a little bit of CS left. So it was really exciting to be able to show him these results. And he was thoroughly fascinated with what he discovered about himself and really understood what was going on. And it was really awesome to share and really give him a vote of confidence and really educate and empower him to be able to be healthier than what he may be used to. So I just want to share this because I thought it was super fun and just some good befores and afters so that way you can see what's going on. His wife is beyond delighted, by the way, that he's learned so much and that we've discovered some root causes of like apnea that have been not looked at for a long time so we can save his life from a heart attack, right? That's our biggest concern. So there we go.